Hi everyone, it's Vanessa Meyer with Dr. Natalia Pellegrino, and we're here to give you your wellness tip of the week. So today we're going to be talking about nasal and sinus health for the winter. It is the season for stuffy, runny noses and dry sinuses. And as the weather changes, our sinuses can become really irritated, especially as we're spending more time inside with the heat on, right? But irritation and inflammation can also occur for those who don't live in cold winter places. So today we're going to talk about a couple of strategies that will promote healthy nasal and sinus passages and keep you healthy all winter long. But before we start, as always, remember our wellness tips are for educational purposes only, and it's important for you to check with your doctor before starting any healthcare routine. And now let's get to the good stuff. Nasal irrigation is a procedure that you can do at home to rinse out and clear the nasal passages. Nasal irrigation, it's recommended to help relieve allergies and sinus symptoms, including nasal dryness, sinus pressure, nasal congestion, nasal symptoms from cold and flu, post-nasal drip, and to prevent colds and flu, sinus infections, and allergic rhinitis. Allergies and infections cause excessive mucus production, yucky. A nasal rinse will wash away any excess mucus and allergy-causing irritants such as pollen, dust, bacteria, viruses, and fungal organisms. This basically flushes the organisms out before they even have a chance to attach and start colonizing, which is typically going to start in the first 24 hours of breathing in the organism. When your nasal passages are dry, they lose their protective mucus layer. This mucus layer is the first line of defense for our immune system when we breathe in germs. Hydrated mucous membranes will flush out all types of germs better than mucous membranes that are dry. So you want to keep everything moist, right? There are a couple of different options for nasal irrigation, and we'll get into these now.
Yeah, so this is very exciting because I love, one of my favorites is the Neti Pot, which we'll get into. But for nasal irrigation in general, you always want to use salts, and specific, we'll get into the type of salt, but some sort of purified salt or saline solution versus just plain water, because you want the solution to be pH balanced so it matches the pH of your sinus tissues. Otherwise, it's really going to burn. And also the salt itself has drawing properties. So if there's a lot of mucus in there, it's going to basically act like a little bit of a magnet, and it just kind of pulls it out. So the Neti Pot, this is the first thing I like to recommend to my patients. It's one of my favorite strategies for any sinus related symptoms, specifically for prevention. So ideally you're doing this periodically throughout the winter just to keep things hydrated, and also at the first sign of getting any kind of like nasal symptoms, runny nose, cold, or flu. And also just good prevention for people who get sick. You kind of get everything that's going around. And yeah, so primarily for prevention. So first you need your tools. You need a Neti Pot, which are typically porcelain. I recommend the porcelain ones because they're reusable and really easy to sterilize. They do sell plastic ones, but you have to get a new one every 3 months. So ideally, you know, spend a few more dollars and get the porcelain one if you can. And we'll put some resources there in the notes for where you can get that. But netipot.com is a really good one, just to keep it simple. And a lot of times when you see the Neti Pot in the pharmacy, you can get on Amazon, Target, wherever, they'll have special salt with it. And sometimes it's just in packets, so it's already portioned out for you. But basically you want to use whatever proportion they tell you with that specific Neti Pot for your salt and water ratio. Okay, and then for the salt, as I mentioned, you want to try to do neti salt, because table salt has other things in it like iodine that might end up irritating your sinuses. And water. So the water that you use is super important because you don't want to introduce just germs into your nasal passages. So I typically recommend just getting a few gallons of distilled water or reverse osmosis. Sterilized water, you can get this at any pharmacy, grocery store. Or you can also do tap water as long as it's boiled for 5 minutes to sterilize it and then cool it down. And then you could store that water in the fridge for up to a week for using just with your Neti Pot. But ideally, you're doing some bottled water because there's a lot of other contaminants in most municipal water supplies, like chlorine, which is added to sterilize the water, but then that can end up being more drying. So ideally, get the best materials possible, but in a pinch, you can do the tap water. So now you want to just gently heat up the water in a clean pot or in the microwave in 5 to 10 seconds increments. And you want it warm enough to dissolve the salt, but of course not so hot that it's going to burn your nose. It's very delicate tissue in there. So you just want to put your hand in it or test it with a finger, make sure it's like, lukewarm room temp. And it's a little bit hard to explain how to do this, but we included the netipot.com has some really good videos on their website. But basically, once your neti pot is filled with water and salt, you're going to lean over a sink. You want to tuck your chin really well so the water doesn't go down your throat. And you're basically just putting one spout into one nostril, and you're sort of turning your head and tucking your chin. If it's going down your throat, it just means you're not tucking your chin enough. And you want to not you're just passively letting it run through. So it'll just run through the other side. You don't want to blow your nose through it or anything, just kind of let it happen. And then afterwards, you might feel a little bit of drainage for a while. So typically I don't suggest doing this any closer to bed than an hour before bed, because then you're going to lay down, get more drainage. So ideally do it at least an hour before bed, and then blow your nose a couple of times when you're done to just get everything out. And then afterwards, Vanessa has a really good tip that she learned from one of her classes.
I do, and I really liked your little tilt of the head.
It's like this.
And it's important with the tucking of the chin, because there's been plenty of times that I got it down my throat because I wasn't doing it properly. So nowadays it's so nice because you have videos that you can watch, but we started these practices years before they had so much on YouTube. So now you guys are lucky, right? So in one of my Ayurvedic trainings at Kripalu, I learned one of the best sinus tips ever. I had already heard about Neti Pot. I'd already heard about saline rinses and things as that. But what I didn't know is that they also recommend oiling your sinuses after a neti pot or a saline rinse. And this was life-altering on so many magnitudes, because when we're talking about these dry climates and we're talking about winter and all this coldness, and then you're heating up the house and everything's dry. And the sinuses, what we say, are the first line of defense, and they're supposed to be moist. Mucus is there for a reason. So if we're drying everything out and we're clearing out that mucus, that sounds great, but what happens now? Now we have this very vulnerable place that could go the reverse way. So oiling the sinuses makes so much sense, right? So I usually suggest to people, you can try using organic coconut oil because it has antiviral properties, or organic sesame oil for its antibacterial properties. You can use a little drop, you can use a Q-tip. We know with coconut oil, it's at room temperature, it's solid, so you have to let it melt a little bit. But the other thing I like to use is Banyan Botanicals has a very nice nose oil called Nasya oil, which just means nose. We've listed that in the links below as well. But you don't have to inhale it fully to get some benefits. If you feel funny about that, you can just take a little bit on a Q-tip and very, very gently get it as high up as you can. And that's typically enough to get the benefits in the sense of, some sort of protection. And you'll also know that very superficially down below is where people start to kind of get all those little cracks and things like that, and we get irritated. So you're already covering all that surface anyway, but the higher up you can get, the better. But just be careful, obviously. You don't want to damage anything. And then also, if you don't love the idea of a neti pot, it's okay. There are a couple of other options like saline nasal spray, X-Clear solution, and my clients personally love to use Alkalol with ALKALOL sinus rinse, and we'll list those links below as well. And now Dr. Pellegrino is going to go over how often.
Yeah, so I recommend when you're in the height of cold and flu season and you have this, increased dryness in your home from the indoor heat, I think that especially if you've been around a large group, these days we're maybe not getting out and about or seeing other humans outside of our homes on, any given day. But if you're going to be around a crowd, you're going to work, seeing people, I think doing this nightly is good on those days when you've had some potential exposure, and certainly when you're around someone that you think might be sick. So doing this at night or every other night can help to, as Vanessa mentioned earlier, just sort of clear, those germs need at least 24 hours to start colonizing and getting established. And then your immune system comes in, starts fighting them, and that's what creates all the congestion. So if we're just rinsing them out and drying them out with the salt right away, they don't have a chance to colonize. But Vanessa also advocates for moderation on that. Maybe she'll tell us what she recommends for how often to do it.
Sure. Yeah, I'm generally a person of moderation in all aspects. And for me, although some cultures will say using a sinus rinse nightly is recommended, I like to do it maybe 3 to 5 times a week, unless, like Dr. Pellegrino mentioned, unless you've been exposed or suspect that, just because I don't think that people are always careful with overdoing it. Once they get an idea of like, oh, this is healthy, I'm going to do this. And then they tend to like just overdo it and strip all the mucus away. And like I said, you don't want that. This is the one place, we really want things to be moist and focused. We don't want to be clogged, but we definitely don't want to be dry. So that, for me, it's more moderation, 3 to 5, unless I'm feeling like, all right, something's going on, or maybe I was out too much or something. Okay.
Yeah.
We'll go over the side effects, which are very, very simple. And this is mostly about how we're doing it. Go ahead, Dr. Pellegrino.
Yeah, and I was going to say, I love the moderation with doing it. And, some people think a little bit is great, so I'm going to do this 25 times a day. And it's like anything could be overdone, even drinking too much water. So, but I also really like the oiling of the sinuses to kind of prevent that dryness. So that's something that I hadn't heard before. So I'm totally going to use that and recommend that myself. So there's a couple of things to be aware of, a few side effects to just note, mainly if you're not using the right materials. But you don't want to do it too often, as we mentioned, or you don't want to use unsafe water. So unsterilized tap water can introduce harmful microorganisms into your sinuses. This can result in serious infections. We don't want anything setting up shop in your sinuses, and there's lots of microbes in the water. So I've had some clients who say like, oh, well, I just heat the tap water up really hot. No, you definitely want to boil the water because that ensures that you're killing things off. Or, if you're wanting to be even more cautious, you just get your bottled water. And then as long as you're using the right ratio of salt to water, as we mentioned, you should not have any burning sensation. But if you have some irritation, like Vanessa mentioned, the cracking, you might feel a slight burning, which should pass after a couple of minutes. But again, you want to make sure you're using the right amount of salt to water for your specific neti pot size, and make sure it's dissolved, because sometimes if it's not fully dissolved, you're just getting all that salt residue, and you want that to be fully in the solution. So any burning or stinging should be minor. And then postnasal drip or mucus drainage, you might feel some kind of like coming into your throats. Maybe it was like really far into your sinuses, and now the salt water is attracting it down. So you just kind of spit that out into the sink. Ideally, you're not swallowing that. And as I mentioned before, you want to do this ideally for preventative purposes. You're starting it, at some point in the winter or at the minute you start having symptoms. But you want to avoid sinus rinsing if you already have a major blockage, like you can barely breathe out of your nostrils, or you're having intense sinus pain or ear pain. If you've had recent ear or sinus surgery, definitely want to wait until that's healed before doing it. If you feel any intense pressure or pain in your ears or sinuses when you're doing this, stop using and check with your ENT or your doctor. And for kids, young children typically advised to use a simple saline spray or something like Xlear spray for kids, as opposed to a neti pot, just because it would be really hard to show them how to do it, and it's just easier to do the saline spray. And of course, anything that goes in the nose, like if you're doing a neti pot in the household, everyone should just have their own neti pot. Even though you're sterilizing it, it would be kind of like, you know, sharing a toothbrush among everyone in your family. Okay. Vanessa, any other tips for doing this with kids? What's been your experience with?
Yeah, with kids, I think it's mostly just a quick saline spray, and you're lucky if you even get them to do that. But also with the oiling of the sinuses, it's worth to mention that that's something you can do daily. So even though you might be using, you know, the rinse not daily, the oiling you can do all the time. And it's also great because instead of putting like Aquaphor or Vaseline up your nose, which is usually what somebody might recommend, now you have a natural version of doing it, which is actually going to give you more benefits, you know, antibacterial, antiviral properties and things such as that. And it's completely safe. And then also if you get some down your throat, you're not worried about it, right? It's just oil that you actually ingest on a regular basis probably.
Yeah.
And kids are way more conducive to letting you dab a little bit, you know, or letting them even do it themselves and then washing their hands off, you know, again. So they're more calm about that stuff than like shoving things up their nostrils.
Yeah.
So let's
Makes
be gentle with
sense.
the little ones. And then I'll go over the at-home treatments that might also help alleviate sinus congestion or infection other than the sinus irrigation. So we have other things you can do specifically to help with the little ones that aren't so excited about doing that stuff, right? Obviously sleeping with the humidifier in the room, you know, using distilled or purified water. I usually, depending on what the situation is with the climate, you know, you want to have a really clean purifier and humidifier, making sure that you're not adding junk to the air and that you're cleaning it out on a regular basis. People don't always clean it out, and then you might notice some pink mold gunk around. That's dangerous stuff. Get rid of that. Breathing in an essential oil such as eucalyptus or peppermint from a diffuser. Remember, you also have to err on caution with children specifically with these things. So make sure you look at what you're doing before you're using it and the quality of your oils. Steam inhalation with essential oils or plain salt water. Dr. Pellegrino, would you like to go over that?
Yeah, so I recommend this as an option for people that are maybe a little bit, you know, not quite ready for the neti pot experience. But it's very similar in that you boil some water, you add lots of salt. You don't have to be as specific with measuring it out, but you want like a heat safe bowl, like a Pyrex or something. And then you put a good amount of salt, like a tablespoon. And then you just put that in a clean sink with a couple of drops, optional essential oils like peppermint or eucalyptus, something minty. With that, you want to use like 1 drop, because like 1 drop of peppermint oil, more than that, I've done it. I mean, your eyes will be watering. So, you know, or you could just do the salt if you want to start with that and keep your eyes closed if you're using essential oils. And then you just kind of like lean over the sink and you create a towel tent over your head, and you could breathe that in for 3 to 5 minutes. It's another option for kids too, you know, get them under the towel and they love it. It's fun. So that's just another option. The other one I wanted to mention is just if you're having like sinus pain and pressure, is alternating hot and cold compresses over the sinuses. So like ice cold washcloth, hot water washcloth, and just alternate each every couple of minutes. And then there were a few other things that Vanessa will tell us about.
Okay, so we had written down we're using a methylated chest rub, and then just, you know, again, going with quality, making sure that you have one that's, you know, organic and that it's age appropriate. That's really, really important when you're using things like that. Taking over the counter decongestants, again, something just to watch for, and you should ask your doctor about this. Decongestants can cause, you know, some issues if you already have heart things going on. So you always want to make sure that you're safe for use specifically. And if you have severe or chronic sinus infection that doesn't respond to at-home treatments, guys, what do you got to do? You know, just wait till it gets worse, because I know people that do this. you have to talk to your doctor, a healthcare professional, and they may be able to prescribe medications that can help. And don't forget, even when you go on your meds, like you don't just stop with everything else. You want to make sure you're having a holistic approach, right? So if you need to take antibiotics, you need to take something else, just make sure you continue with at-home treatments. And really good doctors will always say, like, you want to take a warm shower, you want to inhale steam, you should start talking about that stuff. And that's what my experience has been. So don't forget, you have other options always, but don't wait till you're dying over there, right? And let's go over the bottom line. Sinus rinses are safe for most people to use. They are effective in alleviating sinus congestion and eliminating allergens and irritants from the nasal cavity, keeping nasal passages hydrated and helping to support immune defenses to keep you healthy. That's the key, guys. This is an immune defense. So don't forget that these guys up in here and you have more up here are very, very important, and they have to be cleared out, and they also have to be moist. That's not everybody's favorite word, but it is moist. So
yeah, and as another note, staying hydrated is really important too.
yes.
Just drinking lots of water also helps to hydrate your sinus passages. You don't think about that as, something that can help, but it is your first line of defense. If it's not moist, it's more vulnerable. So we want to make sure that your, immune army is ready to go as soon as something comes in.
That's a great visual. Your immune army. I like that. So that's it for this tip of the week. And we've got one more coming to you. We're going to do that shortly. And we hope you have a great, great week, and happy holidays to everyone. We'll speak with you soon. Be well.
Take care, everyone.